carefully to the dispatch information. Okay? And then watch for Sir Kim. Okay.
Bahala ko. Parang mahirap bibigyan sa akin. Okay.
You and your partners are working for a transporting EMS system. Your service has been dispatched to a rural campground for a person injured with a power saw. It is 7:13 on a fall afternoon. Outside temperature is 7 degrees Celsius with a slight drizzle. From the scene, you will be 60 minutes away from Level 1 Trauma Center.
60 minutes away, level 1 trauma center. So, there's one patient involved in a power saw injury. First thing, I will gather all my equipments together with my partner here. And since the temperature outside is 7 degrees Celsius, I will bring the thermal blanket. And now, approaching to the scene. First, I will check for the scene safety. Is the scene safe?
Scene is safe.
Now, I will wear my PPEs. PPEs on, and also my partner here. Then, now approach my patient. Okay. Hello, sir. I'm Kim. I'm a nurse. I'm here to help you. If you want to say something, just speak. Do not try to move your head. Okay, sir?
Yes, sir. Please help me, sir. Please help me.
Someone help Billy.
Sir, I'm Billy. I'm a nurse. I can help.
Please catch the head for me at my count of 3. 1, 2, 3.
As you release your hand, you'll notice that there is a near amputation of the left hand with profuse bleeding.
Okay, there is a near amputation of the left hand, which means that's with profuse bleeding. So that's active bleeding. I will first manage the bleeding, of course. Side. Nandito ako, dati. Okay. So in the left hand, no?
Yes.
Okay, I'm applying pressure dressing to the affected arm. Is the bleeding controlled?
Still soaked with blood.
Still soaked with blood. So I will apply another pressure dressing. Okay. Is it controlled?
No, still soaked with blood.
Tie it with bandage. Is the bleeding controlled?
Still soaked
Still.
with blood.
So, nag-use ba yung tourniquet?
Yan.
Stop. Bakit? So, since the bleeding is not yet controlled, I will now apply my CAT or the combat application tourniquet. So guys, this is CAT, combat application tourniquet. Then apply 3 centimeters above the wound. Then apply tourniquet. Is the bleeding controlled? Checking
Yes.
for pulse also if there's a
No
pulse.
pulse.
Huh?
No pulse.
No pulse, so meaning my tourniquet is effective. Now, I will write the time of placement. So the bleeding is now controlled. Time is 9:05. So, the bleeding is controlled. I will now proceed to my airway. So in airway, sir, are you okay? Still
Yes,
okay?
sir.
Still
Yes,
with me?
sir. Please help me, sir.
So now I will give him non-rebreather mask connected to oxygen, 15 liters per minute. First, inflate the balloon. After inflated, I will give to my patient. Then, Sir Billy, let's lie down the patient on the ground. I will catch the head. Please do the command.
Okay. I will release my hand. Please support the head at the count of 3. 1, 2, 3.
Okay. Then, now it's time for me also to check the back for any bleeding.
None
And on
unremarkable.
the neck, okay, no bleeding. So, Nurse Billy, we will lie down the patient to the ground on my count of 3. Please support the back, ha? 1, 2, 3. Okay. Oh. Slowly, slowly. Now, Nurse Billy, please catch the head for me on my count of 3. 1, 2, 3.
Catching the head.
Okay. Now, since I assess the airway, I will now proceed to breathing. First, I will expose the chest by using my shear. Then look for, applying LLF, look for chest rise and fall.
Bilateral equal chest rise and
Okay,
fall.
bilateral equal chest rise and fall. Checking for breath sounds.
Good air entry, good air entry, good air entry, good air entry. No muffled heart sound.
No muffled heart sound. Then, feel for any crepitus. Is there any crepitus?
None.
Okay, no crepitus. Unremarkable. So, I'm now done with my B. So, I will proceed to C, circulation. Is there any external bleeding
None.
aside from this? None. So, now checking for the pulse. Of course, left side has no pulse. Right side, is there a pulse? Radial pulse. Quality of the pulse.
Weak.
Weak. Okay. Checking for the skin color, temperature, and condition or moisture. Checking for the color. Pale. Okay. Temperature.
Cool. And
Cool
diaphoretic
and
skin.
diaphoretic skin. After that, checking for capillary refill.
It's less than 2 seconds.
Less than 2 seconds. Then, I will now give IV fluid 100 500 1,000 ml plain LR to his, for example, I get it, okay. I will apply IV cannula to his right antecubital fossa, gauge 14. Then hook lactated ringer solution, fast drip. Okay, 1 liter, fast drip. Then, I will now proceed to my D. D is for disability. Hey sir, still with me?
Yes, sir.
Are you still
Yes.
okay?
Yes, sir.
Okay, so my patient can speak to me. What's your name, sir, again? What's your name?
My name is Henry.
So my patient is alert because he can speak with me and state his name. So now it's time for me to decide if my patient is critical or not critical. So since my patient has an active bleeding in his left hand, my patient is in critical condition. I will call my driver. Driver, please, we will do a rapid transport to the hospital. Then, before that, my driver will get the spine board. Then, I will check for his neck for any bleeding. Is there a tracheal deviation?
None.
Is there a jugular vein distension? Okay, I will now apply DC collar. So, measuring the neck. Checking the neck. Okay, it's 4. Happy. First, remove the oxygen mask. Alis ba? Okay. Apply the C collar. Okay, sir, on my count of 3, please release your right hand. 1, 2, 3. My count of 3, release your left hand. 1, 2, 3. Okay, sit in the middle. Okay, in the middle. Then, apply the oxygen. Assuming I apply the oxygen, Okay. Please, driver. I need your spinal board. Someone help with me here. Log roll. We will log roll the patient to the right side because he has an injured left arm. So, we will log roll him to the right side.
Ano, gusto mo hawakan ni Edwin yung ano mo para hindi matakpan?
Hindi na, okay lang.
Okay.
So, Now, it's my head part. Please do the command. Okay. Please, hand placement first. Okay, sir.
Team, let's lug roll the patient onto his right side.
Sir,
At the count of 3, 1, 2, 3.
Okay, log roll. Checking for the back. For any bleeding. None, no bleeding. So head part to the command.
Team, lug rolling the patient onto his left side. At the count of 3, 1, 2, 3.
Okay, sliding position. Place your hands, sir, on the hips. Sir, please place your hands on the legs, knee on the shoulder. Okay, head part to the command.
Team, sliding down the patient into the midline at the count of 3, 1, 2, 3.
Okay, again, head part.
Team, sliding up the patient into the midline at the count of 3, 1, 2, 3.
Okay. Then now, this is the time to apply the head blocks and straps. But for now, I'll just apply the head blocks. Same in but the procedure is same. We do the lug roll and the strappings. This is the same. Okay, sir, please remove your right hand on my count of 3. 1, 2, 3. Remove your left hand on the count of 3. 1, 2, 3. So now, assuming all straps are attached, we will now go inside the ambulance. So now we are in the ambulance. Okay, Sir Billy. Okay. All straps are attached, ha? Okay. So now I'm inside the ambulance. I will now do the secondary assessment. First thing I will ask is for the initial vital signs. So, may I know the oxygen saturation?
It's 96 with oxygen.
96 with oxygen. How about the respiratory rate?
20.
20, so normal. Blood pressure?
100 over 60.
100 over 60, good. Pulse rate?
110.
110. GC, Glasgow Coma Scale, GCS?
15.
15. Blood sugar?
98.
98. Temperature?
Not applicable.
Pain scale?
2.
Okay, so 2. Pain scale is 2. But in pain scale, you will ask your patient. So after the initial vital signs, I will ask for the sample history. S is for signs and symptoms. So signs and symptoms, my patient has an active bleeding on his left hand with nearly amputated hand. And that's it. So allergies, any allergies?
No known allergies.
No known allergies. Medication, is he taking any medicines, sir? Are you taking any medicines?
Captopril.
Captopril. So what is your past medical or surgical history?
Hypertension.
So he's a hypertensive patient. So last meal intake, what time did you last eat, sir?
2 hours ago.
2 hours ago. Event prior to that, sir, what happened?
So hit the nut in the wood and kicked back.
So the power saw injured his left hand. So now I will do the head to toe assessment, starting from the head, of course, head to toe. Head. So checking for the head for any lacerations, bleeding.
Using what?
Using the D-cup BTLS. D-cup BTLS is D for deformity, C contusion, A abrasion, P penetration or puncture, B burns, T tenderness, L laceration, and S swelling. Okay? Applying all of the D-cup BTLS to when assessing the head to toe. Okay? Is there any laceration, swelling, or bleeding? None? Okay. So checking for the eyes, for the pupillary response. So checking for pupil response. For Perla.
Pupils are equally round and reactive to light accommodation.
Okay, so pupils are in Perla. Then checking for the ears for any drainage.
None.
No drainage.
None.
Okay. Checking for the nose. For any secretion or discharges.
No.
Checking for the mouth also.
None.
Okay, none. Then oxygen applied. Then I already assessed the neck before I applied the C-collar. Neck for bleeding. jugular vein distension and tracheal deviation. So, unremarkable, right? Checking for the shoulders for any injuries.
It's intact.
Intact. Then, now, going for the chest, applying again the LLF. Look, listen, and feel. Checking for bilateral chest rise and fall.
Bilateral equal rise and fall to chest.
Okay, bilateral. Now, I will auscultate for breath sounds.
Gooder entry. Gooder entry. Gooder entry. Gooder entry. No muffled heart
No
sound.
muffled heart sound. Then again, check for crepitus.
Unremarkable.
Unremarkable. So then, I will go to the abdomen, inspect for the abdomen for any swelling, laceration, discoloration, or bleeding. Is there any?
None.
None. Then auscultate for bowel sounds in the right lower quadrant, ileocecal valve. Is there any bowel sounds?
Present.
Present bowel sounds. Then palpate.
Soft. Non-tender.
Soft, non-tender. Percuss.
Normal.
Normal. So, it's tympanic sound noted. Then I will proceed to the pelvis. Checking for instability of the pelvis by doing internal rotation. This is done only once.
It's
Okay.
stable.
Stable. Then proceed to the legs. Check for the legs for any deformities, injuries.
None.
So none, unremarkable. Then go to the pedal pulses. Check for pedal pulses.
Present.
Present pedal pulses. Mark with X. And if check for motor, sir, can you push my hand? Okay. Wiggle your toes. Can you feel this, sir?
Yes,
Where am I touching?
left
Can
leg.
you feel this?
Yes, sir.
Where am I touching?
Right leg.
Okay. Then checking for the arms, the upper extremities. Okay, check for any deformities, fracture, bleeding. None. Of course, here there is a fracture in the hand. So how about the upper arm? Is there any fracture? None. Then again, reassess for his pulses. Of course, here there's no pulse because I have a tourniquet. How about here in right hand?
Yes, present.
Okay, pulse. Sir, can you move this right hand? Can you do like this? How about this? No, weak motor. Can you feel this?
Yes, sir.
Can you feel this?
Yes, sir.
Where am I touching?
Left.
Where am I touching?
Left. Right. Upper
Okay, so now head-to-toe assessment done. I will reassess the patient every 5 minutes for his vital signs. Every 5 minutes because he is critical. I will check his vital signs every 5 minutes. If he's not critical, every 15 minutes. So, checking for the auto saturation.
It's 95 with oxygen.
95 with oxygen. How about his O2 respiration?
20.
20. Blood pressure.
90 over 60.
90 over 60, so still normal. But I will prepare a 1 liter lactated ringer just in case his blood pressure drops. So pulse rate,
108.
Glasgow Coma Scale,
15.
15. RBS,
Unchanged.
unchanged RBS. Pain scale. Sir, do you feel any pain? No pain. So I will assume that no pain, not applicable. So temperature,
Not applicable.
not applicable. So now I will alert the level 1 trauma center 60 minutes away from my location. So hello hospital trauma center 1, I'm Kim from PMC. I'm a medic. I have here a male patient, approximately 30 years old. He was injured by a power saw on his left hand. Signs and sample histories is he has an active bleeding on his left hand but already controlled. No allergies, taking captopril. He's a hypertensive patient. Last meal intake 2 hours ago. Event, he was doing a woodwork and his hand was injured by a power saw. So vital signs are all normal, and interventions done is applied tourniquet and pressure dressing on his Left hand with active bleeding, applied C-collar with oxygen via NRM, 15 liters per minute. He has IV cannula on his right hand with lactated ringer fast drip 1 liter, and he's on the spine board. So my recommendations is please do an x-ray for my patient, and possible blood transfusion, laboratory check, and surgical operation and ortho consultation. That's it.
Okay guys, if you are being called for any trauma, you need to listen carefully to the dispatch information. Okay? We will start with the scene.